Okay, thank you so much, Sylvia and Caitlin, for having me today. I'm Ann Hasselman, and I'm a consultant. I've been working in emergency management for about 20 years now. And for the last 8 or so, I've been working closely with health centers, primarily with the New York State Health Centers, working closely with Chicanes, and have a extensive experience in working on the public health side and emergency management as well. So I'm very glad to be here with you today and share some information regarding, developing and running some exercises based on some practical considerations so that you can have a more successful emergency management program at your health center. Next slide, please. So my objectives for today are to review the CMS exercise requirements for health centers, define the value of conducting exercises as a best practice in emergency preparedness, discuss key principles of exercise design and related tools and templates, and describe challenges and strategies for successfully conducting exercises. Next slide, please. Okay, so what does CMS say? Well, the EP rule, as you know, came out originally in 2016, and it was revised in 2019. And it has many different requirements, but what I've highlighted here are the requirements that kind of go together when we think about how to organize our emergency management program. So you need a documented training and testing program. You need improvement planning, right? And we're going to talk a little bit more about that in conjunction with exercises. But basically, you need to document lessons learned and what you'll do to improve things. And then, of course, regularly scheduled exercises. Health centers must conduct a full-scale, community-based exercise or an individual facility-based functional exercise every 2 years. You can do an additional exercise of your choice on the alternate years. That would be something like a tabletop or even a drill. And then, of course, if you have a real-world activation of your emergency operations plan, that satisfies the requirement for your next scheduled full-scale or functional exercise. Next slide, please. So if I leave you with nothing else from today, I just want to leave you this image of the integrated preparedness cycle and remind you that being prepared is way more than just writing a plan. All of the steps are needed, all are critical. Exercises are particularly critical for capability building. And what's really great about exercises is that they offer you a low-risk environment to evaluate your progress towards your priorities. The consequences are not the same in an exercise as they would be during a real emergency, of course. And the value in exercises is finding out what works and what doesn't work before you actually have to use your plans and set your staff to the task of responding to a given hazard. What's really important here is that it's an ongoing, continuous cycle, gives you ongoing feedback so that you're constantly improving. So you plan, you get all the assets ready that you need through organizing and equipping, you train your staff, you run some exercises, and you evaluate and then put those lessons learned toward improvement planning. Next slide, please. So you have to do exercises, right? But it's a really good idea to do them anyway, even if no one told you you had to do them. They are a best practice, and I can't stress enough how valuable exercises can be if planned well and executed in a way that what you learn from them is valuable. So exercises are great because they help you to assess and validate your plans, policies, procedures. You can identify your strengths and areas for improvement through exercising. Prepares your staff to perform their assigned emergency roles and tasks through practice under simulated stress conditions. Regarding roles, according to CMS, every health center staff member should have an emergency response role. Even if you don't always activate that particular role, everyone should have an assignment and everyone should understand what that assignment is. So in an exercise, you take what you teach the staff through training and you actually let them practice. So they could be, implementing policies and procedures that you only use during emergencies, practicing with tools and templates that you only use during an emergency, learning terminology that's important for the emergency response, those sorts of things. It's also helpful to run an exercise because it helps all of the staff understand each other's emergency and disaster roles and responsibilities. Kind of gives everyone the big picture, and it builds relationships. Not only internally, but also with your partners when you're doing a community-based exercise. Those relationships that you build in advance, I'm sure you all know, are invaluable. Next slide, please. So not only is it a best practice from the objective standpoint of testing your plans, it's also really helpful to provide the exercise opportunity for your staff because it also supports their emotional resilience. So if you can tell people in advance what it is you think they're going to do, what you think conditions will be, how you think they'll have to respond, just having that expectation set for them is really helpful for reducing stress and anxiety that is very natural to feel during an emergency. It would let your staff know that you value staff and patient health and safety by developing the plans and preparing the staff through training and exercises. And certainly last but not least is that when staff learn how to perform their assigned duties under stressful and perhaps scary conditions while worried about their loved ones, it could give them confidence in their abilities. And there's a body of knowledge, about willingness to come to work, and being prepared and feeling confident in their ability to respond supports their willingness to come to work. Next slide, please. Okay, so, I get it, but where do I start, right? That's what you're thinking. Like, I know all this, great, now help me, right? Next slide, please. So what I say is start kind of from the basics, right? Figure out what it is you want to achieve. So what are your priorities? And your exercise priorities should be based on your overall preparedness priorities. They really need to match up. So the variables that go into determining these priorities are here on the slide. It's really important to understand the intent and guidance of executive level staff. What's important? What are they in support of? Regulatory requirements and/or accreditation standards. So forgive me here, I do have a slide that I use for New York State, and that is the actual regulation for New York State in there. But you need to know CMS, HRSA, right? The PIN 2007-15, your state regulations, Joint Commission, etc. What is required? Then you need to look at your most recent hazard vulnerability analysis, or HVA, and that is the analysis that helps you figure out what hazards are of the greatest relative risk to your health center. And there is a tool for that I'm sure you're familiar with, and we're not going to get into that today, but there is the Kaiser Permanente tool is one of the most commonly used in healthcare, and you can adapt that for your needs. Then, of course, you want to look at capability and resource gaps identified from any prior exercises or real events. And that really speaks to the improvement planning process, as I mentioned before. And then, do you want to validate your training? Do you want to test the assumptions of a plan? Do you want to test new capabilities or resources? Like, all those things have to come into developing these priorities. And going through this process, you end up with, what's kind of officially called the multi-year training and exercise plan, or the MyTEP. Next slide, please. So you don't need to reinvent the wheel. You don't need to start from scratch. There are resources, and the most valuable resource for exercise program development, exercise conduct, evaluation, etc., is the Homeland Security and Exercise and Evaluation Program. There are guidance and tools in HCEP for short. HCEP gives us a common methodology for designing, conducting, and evaluating exercises and for improvement planning. You can see everything is a cycle in emergency management because preparedness is never done. You can see here in this graphic, this is the exercise cycle, or the HCEP cycle, and it basically tells you all the steps. And this is for one single exercise. So it guides you through the process for an individual exercise, which is very, very helpful. And there are guidance and templates that you can refer to and adapt for your own exercises. So you do not need to, create things like out of thin air. It's there for you. Next slide, please. So another thing that's really important to do is to make your exercises effective, is to choose the right exercise to meet your objectives, right? You wouldn't pick the wrong tool to do a job. You want to do the same thing with your exercises. So broadly speaking, exercises are grouped into what's called discussion-based exercises and then operations-based exercises. You can see the examples in the bottom row, the lighter colored row. Discussion-based exercises are generally looking at strategic policy-oriented issues, very good for getting people up to speed on plans, developing new plans, kind of letting people walk through how they think things will go, using scenarios and discussion questions. A facilitator guides it, and the time is simulated. So these are things like seminars, workshops, tabletop exercises, and games. But operations-based exercises are when you are kind of getting boots on the ground, we like to say, right? You're actually doing something. You have the players take action as if they're really responding. Time is often in real time. It is very helpful to use an operations-based exercise to clarify roles and responsibilities, identify your resource gaps, and of course to validate your plans, policies, agreements, and procedures. And I would also add in there your assumptions for what your plans are built on. Operations-based exercises include drills, functional exercises, and full-scale exercises. And just a little reminder, drills are one type of exercise. But a drill is an exercise, but not all exercises are drills. Next slide, please. So one of the key principles of HCEP is what's called the progressive approach. And in the progressive approach, you can see here, as exercises go from left to right, you can see the discussion-based are in the lighter blue, the operations-based are in the darker blue. You can see along the bottom, the planning and training gets more involved, more complex as you go from a seminar to a full-scale exercise all the way at the top. And you can see that you build more capabilities, kind of get more bang for your buck when you do an actual operational exercise versus the discussion-based exercise. But why the progressive approach is so important is so that each individual exercise will test individual objectives and parts of a plan or a plan, depending on what you're looking at. But you should build an exercise program that looks at exercises as a series, so that every time you do an exercise in a given series, you're building capabilities. So maybe you'll do a workshop to help develop a plan, then you'll run a tabletop to have everyone kind of discuss it. Maybe you'll do a drill, right? A drill looks at one specific function from a plan. Like a communications drill is a great example. Communication is always important, always a point for potential failure, and relatively a low-hanging fruit for something that you could test and that you should test. Functional exercises are often used to test kind of your incident management structure and how things work from a management standpoint. It's usually in your emergency operations center and your command center. And then a full scale, of course, is bringing all the moving parts together and actually practicing response. Maybe you have actors come in to play patients. You're actually doing something. But what's really important is that you don't just write a plan and then jump in to a full-scale exercise. The progressive approach is meant so that you don't jump into something too complex too quickly. You don't want to set yourself up for failure. You want to build capabilities as you go, because your goal is to actually be successful, right? Even though you're using the exercise to find areas for improvement, ultimately, you want to use the exercise series to build and build and build. Next slide, please. Okay, so more exercise planning tips. Really important. Only test what's there. Test where you're at today. Don't test where you think you're going to be a year from now or at the time of the exercise. You don't know what's going to come up. You may not be able to get where you need to be for the exercise to be successful in the plan development or the staff training. The exception to that is that seminars and workshops can be used to create new protocols and procedures. Again, objectives should be realistic. You need to train staff before you test the plans through exercises. I can't stress this enough. You should not throw your staff into an exercise when they've never seen the plan. It's not fair to them. It's very stressful for them. And you're just setting yourself up for failure and also kind of negative feelings around the exercise process, potentially from the staff. You want to maintain a robust ongoing training program for new staff, because I know there's a ton of personnel turnover. And you want to ensure that your staff are generally prepared for exercises on an ongoing basis. And lastly, you're testing policies and procedures, tools and templates, not individual people. But I will say this, not everyone does well during an emergency. And even though you're not testing individuals and you're testing what you've created for the individual to perform the tasks, you may find that someone you thought could be a leader or that is normally in a leadership role does not do well under the stress and the pressure of the emergency situation. So you might need to reassign people, after you run the exercise. Next slide, please. So I said we would talk a little bit about evaluation and improvement planning. They are critical. And the most important thing to do in thinking about what's also called lessons learned is that you're honest. You need to look at what happened and really assess it as objectively as possible. I think remembering that you're evaluating policies, procedures, tools, and templates and not people is really important. You're not going to hurt anyone's feelings. You're not going to insult your boss, right? You want to really focus on how things work. Evaluation and improvement planning are best practices. And if you train people, run an exercise, evaluate it, but nothing happens after that, you just kind of stick it on the shelf, that's not nearly as valuable as then taking what you learn, right? Analyze and document your strengths and areas for improvement. Take them and incorporate them into what's known as improvement planning. It keeps your plans current. It helps you know that they make sense, right? And you can kind of keep track of how you're doing against your preparedness priorities, right? So maybe you meet a certain priority, you drop it off the list, but you found a new one that you have to add to the list and going through the exercise. So it goes back to the cycle, right? Every step supports the next. Planning, organizing, equipping, training, exercising, evaluation, improvement planning. And I'll just mention again that HC provides tools for evaluation and improvement planning as well. So it's kind of, start to finish from your exercise program design all the way through to improvement planning. Next slide, please. Okay, so making it happen, right? Let's talk about some strategies for addressing challenges. I'll kind of get this discussion started, and I know our panelists are eager to share with you their actual personal experiences in doing this. Next slide, please. So one of the most common barriers we think about and we hear about in getting an exercise program going and running successfully, there's a lack of support, right? Everyone's not on board. Could be leadership, could be the staff. So what do we do about that? Well, again, really important to secure executive staff input, right? What are the priorities of executive staff? And what do they want to see happen? And their support, the exercise program. It's required, and it's also a best practice. This goes back to, approaching your exercise development in a way to make them successful, right? Not exercising plans that aren't written, not exercising things that staff haven't been trained on, including input from across the organization, right? So that's one way to get buy-in across the organization. Include everyone if you can, with any knowledge of how the plans are supposed to work, right? And maybe someone that normally does evaluation should, take the lead on your evaluation. Things like that. Find ways to leverage the knowledge and experience from across the organization to this process. It will improve your stakeholder commitment, and also help people feel valued and see that the impact on them, that they're able to take these experiences and turn them into something meaningful, which is improved plans and improved preparedness for their organization. Again, take your best practices, make them successful, and then you'll improve the perception of value that everyone at the organization has of your exercises. Next slide, please. Okay, so lack of resources. Again, it's a huge problem. Absolutely. But again, there are ways to make this happen without a tremendous time commitment if you're not doing a huge full-scale exercise, right? Use the guidance, tools, and templates in HCEP. Do not reinvent the wheel. There are other existing resources for exercise scenarios, tools, and templates. For example, from FEMA, your Primary Care Association or PCA, your local or state emergency management and public health agencies. These are all excellent sources. And then kind of going along with that, if you can, build these relationships with these partners, you can participate in their exercises, right? Often there's funding and resources that these agencies and organizations have that you might not have at the health center level. You're supposed to be incorporated into those plans anyway. So if you can get in and kind of practice the exercises, you can benefit from participating without the burden of doing all the development, conduct, and evaluation of it on your own. Next slide, please. Lack of time. this goes right along with resources. I mean, they're a little bit interchangeable, but really kind of teasing out the time issue. Try to think about when you can schedule exercises so that it's not as kind of impactful on the schedule. So are you less busy in spring and summer months, right? Because there's less sick visits. And there's less holidays. So maybe people are, I'm sure, going on vacation, but maybe it's not that. There's days where things are just closed, right? Where you're all off. Consider conducting a series of short exercises instead of one single longer exercise. Things like this would be, again, drills, which test specific individual functions. You can kind of break down your plans into bite-sized pieces and test different operational pieces. Or a mini tabletop, right? So you don't need to spend 4 hours and do a tabletop with, 3 modules and 20 questions for discussion. You could do one single module, and then maybe next month you do the next module, etc. You have to find ways to work it in and make it work for you. Then, of course, if you're part of a larger organization, can you leverage that? Can you bring staff together from multiple sites, share ideas, create one single exercise or series of exercise for all the sites? So take advantage of what you do have and find ways to work it in. Next slide, please. So I'll leave you with this. Just don't let this happen to your emergency response plans, right? You can see in the background the exercise machine, and you can see the caption is, hey, we have one of those. You hang your laundry on it, right? You need to exercise your plans. Don't let them be, the treadmill where you hang your laundry. With that, I'll say thank you and turn it back over to Sylvia or Caitlin.
Thank you, Anne, so much. That was so informative, short and sweet, but I know I even learned a few things in the process. So thank you again. We're going to turn now to our panel discussion. And today's panelists are Alan Molesky. He is Logistics and Safety Director of Great Lakes Bay Health Centers, and Heidi Britton, Chief Executive Officer of Northwest Michigan Health Services. I'm going to give them both a minute or two to tell you all about their work and their organizations. But first, I'd like to welcome you both to the panel and thank you for joining us. So, Alan, I'll let you introduce yourself and your health center first.
All right. My name is Alan Molesky. I'm with Great Lakes Bay Health Centers, and we are located in mid-Michigan. I've been with our company. It's been a pretty long time, but my main responsibility here at Great Lakes Bay Health Centers is I'm the safety director, and our safety director, me, I'm also the emergency manager. And so I also have logistics. So I have procurement assigned to me, transportation department assigned to me, and so on. I think we have, 31 different billing locations. But we do have a big fleet of mobile buses. I think there's 8 of them now. And then I know at least we own probably about 14 brick and mortar buildings. And then we're also in a lot of the schools in our area. So I've been working for FQHC for a long time, and I'm excited to be here, and hopefully I can help.
Thanks, Alan. And Heidi, if you could introduce yourself and your health center next.
Great. My name is Heidi Britton. I'm the CEO at Northwest Michigan Health Services, which is on the other side of the state from Allen here in Michigan. And I've been the CEO here for since 2014. Prior to being a CEO of an FQHC, I worked as a public health officer and became really engaged and had a deeper understanding of what emergency preparedness is. So coming into this sphere of FQHCs and what emergency preparedness looks like in this sphere is definitely a little bit different, but still yet important to acknowledge and to move forward. So a little bit about Northwest Michigan Health Services. We were established in 1968. We're the nation's third community health centers that stood up, especially as a migrant and seasonal farm worker agency. I think we're the third in the country, and then in Michigan, we are the second FQHC for migrant health. We're one of 40 here in the state of Michigan. And then you'll see in 2010, we expanded our services to the full community to serve all of our community members. And then in 2019, we really expanded ourselves from just being here in Traverse City, Michigan, and in Shelby, but along the coast on the west side of the state. So the next slide, you can see you can just kind of see where we're located physically in the state. Very similar to Allen, we have probably about 5 bricks and mortars. We have 2 mobile clinics, and then we have a couple of school-based health centers as well. So when I think about our experiences for emergency preparedness, we really went into utilizing it full force outside of the other sort of drills that we had done that were, whether they be downtime drills because our EMR wasn't up and running, or whether it be a fire drill. The COVID testing and running a full scale event in this fashion was probably the most closest of running emergency preparedness project that I've done in an FQHC sphere. And so we provided COVID testing to, in our area, all our migrant and seasonal farm worker camps, as well as plant manufacturing, food manufacturing locations. And so we would have a throughput of well over 200 to 300 people coming through. And that was really unique for us because our agency had never experienced it, never used it, never done anything like that mass event until then. So, and I think you guys are going to ask some more questions about that. So I'll stop there, Caitlin.
Thanks, Heidi. And before we jump into our panel questions, I just wanted to remind you all, we can take questions at any time. So if you have thoughts that come up or questions that come up as we go through these questions, I haven't seen any questions in the chat come up yet, but we're promoting discussion, promoting engagement here. So if you have thoughts or questions that come up, just let us know. So my first question for our panel is, what are the greatest challenges that your health center has faced when conducting exercises? And what strategies did you use to overcome these challenges? I'll let Heidi go first.
If I use my example of the COVID testing, the biggest challenge of that is that most of the agency had never done a full scale exercise and to even know what it meant. Then if you get beyond that and kind of explain, all right, we're going to do mass testing into these locations, and we're going to have hundreds of people coming through, so we need to figure out how to do it well. Then you start assigning different roles, and it was discussed in the speaker before us, is that people have new roles that they've never had before. And for healthcare professionals, I think that's somewhat difficult to wrap their heads around, that they would do something different than they normally do every day. Public health, I think, it's public health has a fashion so that it's normal that you would have maybe some other roles, or you were trained because you took extra classes on it. But for healthcare providers, I think the idea that you would do something other than what you were trained on in healthcare was unique. And so I found that some of the bigger challenges was just the language that had to be used and helping people to understand that maybe just because I'm the CEO, I don't have to be the incident commander, but that someone else in operations that isn't normally in a lead role is now the incident commander because they're running this testing space. So I think just the language barriers, the challenges of understanding of that now you're going to play a different role that they don't practice enough. We don't practice it enough, thankfully, like in real time. And the challenge, I'll just say the last challenge of this specifically, to emergency preparedness is the time to find the time to do this work. Even if you partner up with another agency that's doing a full scale, you don't get the real good sense of playing a different role in work that you really have to do. So it's hard.
Thanks, Heidi. Were there any strategies that you used to overcome the challenges that you mentioned?
Yeah, I wrote it out a lot. I did a lot of on the fly education of what this looked like without doing the ICS 100 and 200 courses, because no one at that point was going to go and take a bunch of courses. So we kind of, we just kind of inserted some of the language. I'm pretty fortunate. I think Alan, especially with his firefighter experience too, like I had this training. Had I been a CEO that did not have this training, no one else in my organization really has that strong training in it. And so it really relied on a whole lot of education and at laying it out for folks and letting them feel their way through it. In our situation with the COVID testing, it had to be done fast. It had to be propped up quickly. And they rose to the occasion. Luckily, we have a bunch of healthcare providers that are also and FQHC employees that are extremely intuitive and adaptive to what we have to deal with and how we manage through it. So it worked. And it took it was a lot of, after, we did it several times. And so you could kind of get better at it each time. But the first time, definitely challenges with it. And it was just education.
Thank you. What about you, Alan? So what were the greatest challenges your health centers faced when conducting exercises, and what strategies did you use to overcome these challenges?
Yeah, so recently, I'm going to say about mid-COVID, so we still were doing emergency drills during COVID because we get injects every day, right? I mean, life goes on. Our biggest challenges is time. So one of the challenges we have is holding a 2 or 3 hour exercise that involve multiple people because we're all short with staff. This is nothing new lately for everyone. I mean, we don't have the staffing that we desire. So what we did for the last 2 exercises, actually, I just finished up an exercise maybe 2 weeks ago, is we did 1 hour time frames for 4 weeks in a row, but only 1 hour per week. And so I'm not taking a lot of their time to do daily operations. So that has been one of the biggest challenges. So we just kind of adjust, and we this particular exercise recently, I only would have the executive team participate. The previous exercise, I would not allow the executive team to participate. Others had to step up and fill roles. So timing is the biggest one. I do agree with Heidi, though. Terminology is a struggle always. And I know a lot of us in my organization did the ICS 7, 800, 100, 200. A few of us have 300 and 400. But a lot of those individuals have since retired. And so now I have new staff or newer staff where I hate to say I have to, I just got to bring it down to a level they understand, because FEMA does use a lot of terminology that if you don't use it every day, it gets confusing. But it can be overcome. It just takes time and commitment to do that.
Excellent. Thank you both. So my next question is kind of a two-pronged question. The first part of it is, did you conduct any improvement planning as part of your emergency preparedness activities? If you did conduct improvement planning, are these strategies or are there strategies you found helpful for creating an improvement plan and then tracking corrective actions until they were completed? And if you weren't able to, what challenges prevented you from conducting that improvement planning? And I'll let Alan go first this time.
Yeah, so improvement planning really comes from what we do is from the after action report. And so we review our objectives, what we want to accomplish, and if we met our objectives, do we need improvement? I'll give you an example. That one that we did earlier this year was an actual event. We had a dark web event. At least that's what I named it, the dark web event. So there was a data breach from a third-party vendor who had all of our employee information. And it got released on the dark web. So we were notified of it. So we activated our emergency management plan, thinking that we would have an incident response guide for this type of I want to say emergency or event. We have one that's a cyber incident response guide. And incident response guides, just so some of you don't know, come from, I believe it's the Hospital Incident Command System, the HICS forms. I believe they come from them, if I'm not mistaken, but if you just search incident response guide for healthcare, they'll come up. But there was one for cyber, but it really didn't solve any issues because we were not the ones that had a breach. It was a third party. We were dealing with a third party who our employees were all affected. So in the improvement plan, one of the things that was recommended by our incident management team in that was create an incident response guide for I can't remember the exact word. It's not called dark web, but I think it's just for it's not cyber attack. There's another term that we use, but for something like that an outside agency has affected us. So that's how we use or that's how we talk about improvement planning. That's just one example that I have, but it's really mine come from the really after action report. Now I can also tell you we also do fire drills, tornado drills, active shooter drills, all these other drills. So there are certain parameters, such as a fire drill, that one of the thresholds that we have is they have to get out of the building, and we evacuate patients. We do. They have to exit the building within 3 minutes, and the building should be clear. And if they don't, they fail. So we have to do another drill. Now, I never do the drill on the same day. We always reschedule it, but that's an improvement plan where if that was to happen, if they failed, and I've had sites fail before, we actually go in and have a little bit of a class on fire response before we conduct another drill. So just kind of, I hate using the word re-education. I hate that, but we just want to go back and reiterate how important a drill is to do. That's really what we do for improvement planning.
Excellent. Thank you, Alan. And what about you, Heidi? What about for your organization? Did you, were you able to conduct any improvement planning? If so, were there strategies you found helpful? And if not, what were those challenges?
Right. So again, I kind of go along the same theme of it was a lot of education and training. So I had introduced what is so fondly called as a hot wash. Yep. And that, again, we never really did a lot of after action reports for a lot of our drills because we don't have an Alan, although I'd like to hire Alan, although I won't, but you know, we don't have an Alan, right? So I don't have anyone in my agency that is trained in that fashion to be able to lead this during times that is, you know, whatever. So, but we as an organization value quality and value a culture of quality. So we are always doing you know, PDSA, so Plan, Do, Study, Act. So we're doing that consistently, which I'm trying to like bridge, although I don't have an Alan, the organization does this work naturally throughout healthcare? What we did specific for our COVID testing that was a bit of a challenge, and I also do it whenever our mobile units go out and try out a new event, is, you know, this hot wash. What worked, what didn't work? How do you improve upon it? You know, and really writing it up and holding people accountable to it. Because what happens is, I think, especially in time of crisis or a real emergency, is you're moving so fast, you often have the same people doing that hot wash that you had doing the work. And so you can get back in a room, you can discuss what needs to be improved, but then you really got to hold people accountable to actually do those improvements instead of just keep on moving along, because you have another testing site you have to do tomorrow. And so if you identify that you need more cones, who's going to get the more cones, and who's responsible and accountable when you have a slim staff to do that work? So that was one of our challenges that we had with it is, okay, we have all these great ideas. We see how we can really improve upon this. Now we have to hold everyone accountable to actually do that work, so that we can make it a better event next time. But the next time is usually within 24 hours and you're just cooking it. And so I really thought that but once I got that kind of settled up, they started doing it naturally, because they definitely saw the value of it, and they continued going with it. So that's what we do. I also know that patient-centered medical home has, you know, tying it also back into what we just normally do in our daily lives here at the FQ World. They really do have you do drills, right? So at least ours, we're certified through AAAHC, and we have to do drills on a regular basis. So we are using those drills that kind of fits into all of this. But the real, like, if I were to talk like FEMA work, right? That was really the COVID testing. That was really starting to implement the new language that can be utilized in a situation where if I had other players involved, they'd understand it. So here's an example. We invited the police, right, to do some traffic work for us. So they naturally show up at your place and just want to know who's your who persons, right? And it's like, I don't know, I'm not sure. I could probably give people like badges of what, you know, what their role is. But again, I don't have time to train everybody on like what that role is so that the police can talk the same language. But ideally, that's what you would have, right? So everyone talks the same language and is trained on the same thing. I'll just say one other thing, and then I'll stop. The other connection I made that was really helpful is I had the health department partner up with us, and they do know that language. And so they also helped remove some of those challenges and barriers because they do breathe it and live it every day.
Excellent. Well, I still have a couple more questions we had drafted for our panelists, but since I did encourage questions, I want to make sure that we get to them with the time that we have left here. I also saw that Tina shared in the chat a resource here, but I think it might have just gone to our panelists. So I made sure to copy that for everyone to take advantage of. I'm not sure what that is.
Caitlin, can I say something with that?
Yeah.
The incident response guides, you can customize them. Don't be afraid. What works for you, it's okay. Just because it's a lot of hospital-based stuff, but it's something. It gives you a guideline. So we customize ours all the time. I still use some of the hospital ones because we really don't need them. I mean, it's pretty unlikely we're going to get it. Well, we could get an earthquake here, but pretty unlikely. But I have it. But for the stuff that I know that we use, we customize it.
Excellent. Thank you, Alan. So I'm going to start with some audience questions. And for this segment, Alan, Heidi, Anne, feel free to jump in as you wish. And if there's something that we can't answer today, I'll try to get any resources or further information and send that out in our follow-up email. So one question we have here is, how do you incorporate the patient perspective or patient populations in your emergency preparedness planning?
At least I can say from my point of view, it is part of our emergency management plan. It's part of our safety manual also, that we always have to consider our patients and what we do. I hate to say what we do with them, right? But it's all part of the plan. To get specific, I would have to really talk about something like really specific. So in a fire drill, they evacuate. In a tornado drill, we actually take them to the basement. Now, there may be some times where they can't evacuate to the basement. Great. We have to have a plan in effect to get them in an interior room without windows. So the only time we do not include patients in any of our drills is an active shooter drill. We will not do it. It's all about hiding, even though it's run, hide, fight, or Alice, whatever you want to use. That's the only time that we don't. Because we have to also deal, especially with behavioral health, special populations. Our staff need to be trained and do that and do it. And doing drills builds experience and gives you the knowledge, the data in your head to take care of that situation. And to if it worked, it worked. Great, use it again. If it didn't, don't do that again. Real simple.
I think I would agree. I also think one of our challenges that we've had when we involve our patients in our drills are two other examples. Our dental patients, if they're in the middle of a procedure, we usually have to either say it's okay, because that's really hard to pull someone off of a drill and a fill at that point, or in the middle of an extraction, but yet our team knows if it was a real true emergency. And the other one we had just finished doing, which was it was a code where we had a person that had, faked a fainting or whatever on the ground, and we had to be really cognizant of who we had around us when we drilled it, because we didn't really, like behavioral health, right? Didn't want to like disrupt. We wanted to be sensitive to our patients if they saw someone laying on the ground. So really being thoughtful of how you do the drills, to not upset unnecessarily. It's one thing to drill. We're not drilling the patients, right? We really need to just drill our staff. And so we don't need to create trauma for patients while we're just drilling for ourselves. Kind of to Ellen's point, there's no active shooter drills that we're doing that we would incorporate with our patients or have. And then of course, when the real time came for like our COVID testing, the patients, we had to practice with them. So that was a practice piece where we tried to, and we had to grab extra translators. We had to grab extra folks who could help with the language barriers, just reading language barriers. So we're always taking in consideration of what the patients face, how that faces the exercise.
I can also say, and I agree with Heidi, because I do look at the schedule. We look at the schedule and see what procedures are going on. Absolutely. But I also, so for a fire drill, I stand at the front of the door, or I have somebody stand at the front of the door if I'm not doing it, and thank the patients for making us a safer location. I think that's important, just to thank you for your participation.
Awesome. Thank you both. So we just have a few minutes left. I did want to get to this question though. For the top emergencies, we'll share the HVA that Anna had mentioned, which I think we can clear that up in the follow-up email. But whoever wants to tackle this, maybe in 45 seconds or less, what would you recommend be the first step for a health center to do in planning for a practice emergency drill?
So I'll just go back to what I talked about on the slides, and that is to determine what your priorities are. What is it that you want to achieve with the exercise? You have to kind of think through where you want to get, so you know where to start.
Yeah, set your goals low, and so you can achieve them to build confidence. Really?
Right.
I mean, and really.
Well, right, and then and the whole progressive approach. You can break things up into smaller pieces, and build and build and build.
I also think like the closest to likelihood of what you'll actually have for an emergency is number one, like where you should be focusing on first. I would have never in a million years thought I'd be doing a testing for COVID, right? So I wouldn't have done that full scale exercise without partnering up with somebody else who was already doing the full scale exercise, right? And so, yeah, low hanging fruit all day long.
Excellent. Thank you all for your wise words there to close us out. So before we head out, I just wanted to thank our panelists and our speakers so much. You'll all be receiving a follow-up email from me, but if you have any lingering questions, please let us know.